Hello everyone and welcome back to our channel. Today we are diving into an important mental health topic, Obsessive-Compulsive Disorder or OCD. I'm Nicole Fernandez, counseling psychologist at TalktoAngel. And today we have Dr. R.K. Suri with us to answer some common questions about OCD. What exactly is Obsessive-Compulsive Disorder?
Thank you, Nicole. The obsessive compulsive disorder comprises of two things. One is obsession, another is compulsion. In OCD, one gets intrusive, persistent thoughts which are overwhelming, which hampers the functioning of an individual. OCD are of a different types. It could be for contamination, which is most common. The other type is the HOCD religion, HOCD relationship, and many more.
What are some of the common symptoms of OCD?
As I mentioned, in the OCD, the individual normally encounters thoughts which are very, very intrusive, which are persistent. He or she is not able to resist those thoughts, which comes as a pop-up in the computer screen that if I don't do this, then something untoward is going to happen. So there's an impending fear, danger, anxiety related to any thought which is becoming overwhelming. As a result, patient does certain action or behavior which are compulsive in nature. For example, washing hand, and that the individual has a thought of contamination, and on account of it, the individual washes the hand as many ways, as many times as possible, and many times you find their hands are full of frigidity on account of excessive use of the soap.
Could you tell us what are the causes of OCD?
Well, Nicole, as far as the causes of the OCD is concerned, there are no definitive answer. It is a conglomeration, or it could be from genetic reasons, it could be from biochemical changes, or the faulty learning, or other behavioral issues. The one theory is a theory which talks about that it is an anxiety which is on account of dopamine and serotonin levels are not adequate. Exact reason for the OCD is yet to be identified.
So let's move on to how is OCD typically treated?
As far as the treatment is concerned, there are two approaches. One we call as a medication approach, another is we call as psychotherapeutic approach. In the medication approach, invariably the anxiolytic and antidepressants, SSRI, and the antidepressants are being given. In some cases where the thoughts are so weird and it is a manifestation in the form of a psychotic disorder, then psychiatrists often also include antipsychotic medication. When it comes to the behavioral management or psychological or psychotherapy process is concerned, the most important therapy which is used for OCD is cognitive behavioral therapy. And in cognitive behavioral therapy, we often use ERP, exposure response prevention therapy, which is very often used in the treatment of OCD. Nowadays, we have also been trying onto the VR and based ERP, virtual reality and or based ERP processes, which helps in terms of visualization and exposure to the situations, incidents which makes the person obsessed or fearful. The most common example is that the person has a fear for entering into lift and has obsessed thought, if I go into the lift, I will choke up, I will die. So in that cases, the ERP is being often used.
So let's talk about how can OCD be managed effectively?
As I mentioned that there are two approaches in terms of treatment. One is the medicinal approach or the other is the behavioral approach. And the third approach could be self-care. In many of the cases, many of the OCD patients also utilizes self-care practices which helps them to better manage their obsession and compulsive action, which on the utilization of technology, currently many of the apps are also helping in terms of self-care, as well as involvement and engagement and support from the communities. The community or peer support often help in terms of the better management of the OCD.
Finally, let's talk about how can counseling at TalktoAngel help with OCD.
At TalktoAngel, we have taken a special area of expertise as far as OCD is concerned. Many of our therapists are fully equipped and trained to provide CBT and ERP, which often is used in the treatment of OCD. I would request you to kindly approach to the best psychologist for overcoming the obsessive-compulsive disorder.
Thank you, sir, for your answer, and thank you for joining us today. We hope this information helps you better understand OCD. See you all in the next episode.